Alice, and thanks to AEI and PPGH for sponsoring this opportunity to share what a few employers are doing within our own employee health plans. It was interesting because I think you referenced market power because due to our size, and I'm not sure that any of us would agree that we actually possess any market power, even though we are as big as we are.
You buy a lot of stuff.
We buy a lot of stuff, but it's very distributed, and there are a lot of market forces that we are dealing with. So I don't know. That's one part of the challenge that we face every day. So at Walmart, as Alice said, we do have a lot of associates. We call our employees associates. We have about 1.2 million people for whom we provide health insurance within the United States. More, of course, outside the United States. So we're bigger than many health plans, but we are distributed into every zip code in the United States, which is in and of itself a challenge. So as we look across our entire population, we do and have used a number of these different mechanisms that we'll talk about here on the panel. What I want to share is a little bit about what we did with bundle pricing, specifically related to our centers of excellence. So our initial drivers several years ago were not really about the cost of healthcare or how we paid for healthcare. We knew that was important, but our biggest driver is around the quality of the care that's provided to our associates. There is a wide variation in both cost and quality across the United States. We know that we had patients going to providers that were not getting the highest quality, and so we wanted to ensure that our associates, our patients, and their family members knew where to go to get that highest quality. So we focused on creating centers of excellence. We focused first on procedures where there is little dispute about what the protocols should be. The evidence-based medicine should be for certain cardiac care and certain spine procedures. We went about finding a handful of facilities that are top-tier, high quality. Not that these are the only facilities that are top-tier, high quality, but we wanted to have a small number that were geographically dispersed that also would meet our quality barriers or limits. As we were developing it, we determined that we wanted to ensure that we had aligned incentives between the facilities providing the care and Walmart. So we were all aligned in the primary focus is quality and not just delivering care. So what we did was create a bundle, and it's a prospective bundle. And it's an important word because it differentiates between the way bundles may be created and in particular the way they're created today within Medicare. But many other companies or carriers, insurance companies, create retrospective bundles where after the fact you determine what the total cost should have been. But this is a prospective bundle. We worked diligently with the centers that we identified, and we said, this is the amount that we're going to pay for the care, and then went on to define what the amount of the care, or not the amount, what the kinds of care that could be included in the bundle. So two things. First of all, that amount that we negotiated was not very different than the amount we would have paid on a traditional fee-for-service. So this was not about negotiating a price that was a low price. This was about creating a scenario for the provider that would say, look, we're just gonna say we're gonna pay this amount, you determine all of the care that needs to be delivered within that bundle, whatever it is, and we're not going to try to dictate exactly what that care is. We're not going to limit you, nor are we going to encourage you to provide care. Now clearly, they also have certain requirements of delivering outcomes that are high quality outcomes. We picked high quality providers to begin with, and we wanted to make sure that they delivered high quality outcomes. These bundles are, they include the pre-op, the surgery, the post-op, and the return home. So it's the beginning and the ending are defined. There are 2 bundles, though. There is the original bundle, the first bundle, which is an assessment bundle. That's where our associate, who has 100% coverage if they have one of these procedures needed, if they want to go to a center of excellence, the procedure is covered 100%. No deductible, no coinsurance, whatever. If they're in our plan, it's covered 100%. In addition, all of their travel is paid for themselves and someone to go with them, a caretaker to go with them for whatever period of time they need to go to that facility. They go to the facility and a team of clinicians works with that patient to first assess the situation regarding their need for surgery. The team works with the patient through shared decision making, through conversations with physicians who are specialists in their own little areas of expertise, and make a common decision amongst the team about whether or not surgery is actually indicated. The team also includes nurse navigators. It includes the facility. It includes all of the people that would be involved with discharge planning. So there's an entire team integrated across the facility. They make the assessment about whether or not the procedure is necessary. They work with the patient. If they decide surgery isn't necessary, collaboratively, they give the patient what it's going to take. Clearly, the patient didn't go there because they felt good. They went there because they have an issue, right? So they help the patient figure out how to solve that issue, but it may not be through surgery at their facility. So the bundle does not encourage the facility to provide surgery. The bundle encourages the facility to make the right decision for the patient. If the decision is surgery, then the bundle, of course, covers the patient cost of the surgery. The bundles are risk adjusted, so if a patient comes in with a lot of additional comorbidities, then the amount that's paid is adjusted because there's going to need to be a lot more specialists and other care given when the patient is in that facility. So we're tracking, of course, all of the outcomes, and they're really great outcomes. Our patients are coming back and saying that they couldn't have had a better experience. They ask questions like, why isn't healthcare like this in my neighborhood? Which is a painful one for us to hear. But we are, and it's interesting because the facilities that are working in this arena for us talk to one another and through structured conversations, and they share the best practices. How are you treating this kind of a patient that comes to you with this set of criteria? What are you learning about this? How are you treating? So there is an elevation of all of the centers of excellence around how they're learning about treating these patients. We actually were surprised, very pleasantly surprised, but surprised at the number of people who went to the centers and determined and found out that they didn't actually need surgery. And it's happening now. We started with spine surgeries and heart surgeries. We expanded into hip and knee surgeries. We also have now expanded into bariatric surgery and cancer, which may or may not be surgery, but it's a center of excellence for the assessment of the treatment of the cancer. The surprising thing to us is the number of patients that go to the center and discover that they actually don't need surgery at all. They actually need a very different treatment regimen. And that's happening in every one of these areas of expertise. And in the cancer area, it's shocking how many times the patient goes to our center of excellence and determines that they actually have been misdiagnosed. Or the treatment is the wrong treatment. I mean, cancer treatments are really, we all know how to treat a particular cancer is very, very difficult. So figuring out the right treatment is the most important thing. So the savings that we're experiencing at Walmart are not about the fact that we have negotiated a bundle or that care is being not given because we incented the center to not deliver the right care. It's because we're determining that harmful care might have been delivered to the patient, and we're avoiding that harmful care.